And like I say, we're in pandemics right now. We're in pandemic of obesity. We're in pandemic of, for some reason, all these cancers that are untreatable springing up very rapidly. I don't know what that's about. And so we're in pandemics now. So if we don't look how we respond to that pandemic, we're not going to treat these ones right either. So it's super important. That's my point.
Alberta's 269-page COVID-19 review report has sparked fierce backlash from mainstream media and TV doctors since its January 24th release. Commissioned by Premier Danielle Smith, the report critiques pandemic response leadership and public health measures, but critics attack it without addressing the data included. In this interview, Dr. Gary Davidson, author and lead of the review, reveals the challenges faced by the task force when trying to gather honest feedback and stresses the crucial need for transparency in future health responses, especially when unprecedented measures compromise civil liberties, informed consent, and tatter societal fabric. Dr. Davidson discusses some of the task force's findings and recommendations for better future preparedness, including tackling ongoing health crises like obesity and cancer. Here's what the doctor the media is trying to cancel has to say.
Why did they take it on? Well, during the pandemic, I stood against some of these public health measures that I didn't think made much sense scientifically. I had a keen interest in the vaccines. I was reading Pfizer's papers before the vaccines ever rolled out. I shared them with everybody I could. Got in trouble, actually, for sharing their own information, calling it creating vaccine hesitancy, which made no sense to me. I just like, we're doctors and scientists. We should be studying this.
Dr. Davidson's commitment to examining the science and evidence, or lack thereof, behind these public health measures led him to the review task force. What most surprised him about all of this was the reluctance of others to openly discuss the pandemic response and the data used to justify them.
The things that surprised me the most were the fact that so many people wouldn't talk to us. They were absolutely afraid. And I didn't understand what that was about, although I've been gone through it and the threats and things that came against me. I understand. I guess people aren't used to that. And we had people tell us that they were sworn to secrecy and they couldn't talk about it. And they're still afraid to talk about it, even though technically this pandemic is over. They're still not sure if they could speak to it. And I didn't understand that. And I still don't really understand that.
With an entire chapter dedicated to governance and flow of information and another to regulatory bodies, the review found that much of the information used to justify Alberta's public health measures came directly from the government itself, particularly Alberta Health Services under Dina Hinshaw, who declined to participate in the review despite being invited.
We weren't able to talk to her. We did ask to talk to her. We asked to talk to everybody that was the decision maker during this in Alberta. And in the end, we had a very few people willing to talk to us. So I didn't get her side of where she got it from. But in the data flow and governance chapter, you'll see that it appeared that there's committees at the federal level. And I'm not saying federal government, but at the federal level, with Public Health Canada and other entities like that this data flowed to Alberta, either through the Chief Medical Officer of Health, through the Alberta Health Services, or into the, we call them EOCs. Well, that was also in the Department of Health. So it appeared that the data or the information was given to these three different entities, and then those three entities presented it to cabinet to make decisions. That's the best we could find, but we couldn't get anybody to talk to us to clarify that.
In spite of repeated attempts to clarify evidence and source government information, Dr. Davidson confirms what many, including myself, have been reporting. The messaging from regulatory bodies was so powerful that it effectively acted as a censoring force to silence regulated professionals into compliance with public health messaging for fear of reprimand.
There was enough messaging sent out that people knew that if they spoke out against this, there would be dire consequences. And so the regulated folks were very careful what they said. And I don't think that's the way science is supposed to work, not without a proper public discourse anyway. So there was that. And then there was enough of us that got in trouble, and it was public enough that everybody knew. So the rest of them knew better than to do what we were doing.
When asked about prioritizing recommendations, Dr. Davidson emphasizes that we're already in multiple pandemics, and the key to preparedness is public discourse and focusing on improving overall health outcomes.
Well, we're in pandemics right now. If you listen to what's going on in the States as they're confirming cabinet down there, we're in a pandemic of obesity, more maybe than the States than us, but I don't think there's a big difference. So that's a pandemic. We're in a pandemic of cancer. I have no idea what's going on, but every day I'm getting calls from people who are in these untreatable cancers, and I don't understand. And it's horrible, but literally every day. And so we are in pandemics as we speak. So how do we deal with the ones we're in? And so just talking to people this morning about this. So we have people wanting off-label treatment, for the obesity. So Ozempic is a big one, and I should maybe use trade names, but this is a massive company, and they're pushing it off-label for obesity treatment. It's not approved for obesity. It's for diabetes, but people are using it for that. This is off-label. There's some possible serious side effects. So people come into me every week asking me for this medication, and I had to go do my own research. So I actually went to their own website, printed it off, and these are the possible things that could happen to you. We don't know the number or what the probability that you'll have this, but it's real. So you go read this, do your research, come back next week. If you still want it, I'll give it to you, but understand that this could harm you seriously. People want ivermectin and fenbendazole for these cancers that are untreatable, that the oncologist is saying there's nothing I can do for you, we're just going to make you palliative. Well, as far as I'm concerned, if you're at that stage, you want to try anything, you can try it. And these people phone me, well, I don't know how to treat these things with antiparasitics. I really don't. So I have to go look it up. Well, what would be really helpful is if we could do a database, if the doctors started treating people like this, giving them Ozempic, for instance, for obesity, which is a pandemic, and the doctors had to follow certain protocols when you do this off-label. You had to make sure the patients are aware, make sure that you're ordering certain tests at certain times so we're not missing things. The patient should be given some way to record their symptoms and how it's going for them. And all of these are a pandemic. So this is how we should do it. And that way, we could see very quickly if there's safety problems, if it's working or not working, we could know really quickly. So this is how you do public discourse, full disclosure, and watch it very closely. And this is easy to set up to do in Alberta. So there's two examples that we're in right now.
Davidson says regardless of what the mainstream media conjures up and regardless of the stance of the Alberta Medical Association's president, Dr. Shelley Dugan, that this does not represent his views or those who have reached out in solidarity both before, during, and now after the report has been released.
I am part of the AMA, so to say that the AMA responded makes no sense because I sure didn't. And I've had lots of doctors phone me, write me, and text me and say that they don't agree with that. So to say that that's the AMA, doesn't really make sense to me. She put her name on it, so that's her opinion, and that's fine. She can have her opinion. But instead of calling it disinformation, misinformation, dangerous, and all these things, again, open public discourse. Give me the study, the result, the recommendation that's what you call dangerous or misinformation. Let's go over it. And if it is, I'm happy to change it. Absolutely. That's how science works.
But that's not the case, not so long as pandemic profiteer Timothy Caulfield is involved. He is leading propaganda campaigns not only to dismiss, but to fully retract Davidson's COVID report, and his actions are suspicious given his lucrative role as a narrative enforcer. Caulfield received millions in government funds, including $1.5 million in 2022 and 2023 for the Science Up First initiative, plus millions more in taxpayer-backed grants dating back to at least 2016. All while earning a six-figure salary of over $250,000 from the University of Alberta, with nearly $50,000 more in expenses a year. He's using taxpayer money to silence dissent and push government narratives, but neither he nor conflict of interest-riddled government-funded modeling projector David Fisman will show up at events to debate any of it.
I was at a pandemic planning, trying to remember the name, but it was in Stanford University in October of 2024. It's put on by the Stanford Medical School. So a world-leading medical school. It was sponsored by the school itself. And I was there. And for what I understand, talking to the organizers who I chatted with, these folks were invited to come and share their science with world-leading scientists. that were there. Dr. Jay Bhattacharya, who's going to be the head of the NIH in the United States, was the host of the conference. So he invited all of these people, come and tell me what I'm missing, and they wouldn't show up. That I understand. I had nothing to do with that, but I was told that they just didn't show. And saw some of the replies, not necessarily from these folks, but from other folks on that list that didn't come. And this is not how science is done. We don't throw things at each other in the public square. We sit down and talk about it. And it was a fantastic conference with people that disagreed with my view, and it was great to hear. And it was great to hear their science, and it's great to hear their concerns. And that's how science is done. It was a fantastic conference, so I just wish it was done like that.
When asked why this kind of review isn't happening in other jurisdictions in Canada, and especially on a more broad federal level, Dr. Davidson says it boils down to courage.
Well, if you watch the media, which I don't, I was told this morning it's a storm of some kind. And not every political figure out there has the courage to do that. And I have a ton of admiration for our premier. I'm not saying I agree with everything she believes or says or does, but that takes courage to look and see, did we do it right or wrong? And not everybody has that courage. That's about what it comes down to it. And some people maybe feel that they were part of it and are afraid to look at it. But in medicine, we do something, and I've mentioned this a few times. We do M&M rounds, mortality and morbidity rounds, after something doesn't work the way we expected in a medical procedure. And we bring in the people that were involved and everything. And we look at every process and procedure and function and how did it happen. It's not about pointing fingers, signing blame. We just don't want that to happen again. So this is what this is. This is, did we do this right or wrong? And I'm sure there's some things we did right. And people have said that, AHS did absolutely everything wrong during the pandemic. That's not true. There was people having heart attacks that got treated world class. There was people having strokes that were getting treated world class during the pandemic. Don't tell me that was wrong. So, I worked in an emergency department. People come in with broken arms and terrible things happen to them. We did our best, just like we did 5 years ago. So to say that did everything wrong is not true either. So we don't throw everything out, but we have to review how we did it to make sure there's something. If we can do it better, let's do it better. Let's not just say, okay, we're not going to look at it and pretend it never happened. And like I say, we're in pandemics right now. We're in pandemic of obesity. We're in pandemic of, for some reason, all these cancers that are untreatable springing up very rapidly. I don't know what that's about. And so we're in pandemics now. So if we don't look how we respond to that pandemic, we're not going to treat these ones right either. So it's super important. That's my play. But it's courage. It's courage. Our premier had the courage to take it, and she's taken a lot of heat for it. And I admire that. And there you go.
Now, in the coming weeks, we'll see what changes emerge from this report. Already, there's been movement with the second overhaul of the Alberta Health Services Board last week since the Premier took office. But it's clear that action is needed, starting with restoring the scientific method, prioritizing public discourse, and moving away from pharma-funded dogma to empower Canadians in improving their own health outcomes. Because ignorance may be bliss, but knowledge is power. For Rebel News, I'm Tamara Ugolini. A key finding in this report was to move away from recommending the novel modified RNA injections, especially for use in healthy children. If you agree and you'd like to support this kind of reporting and this work, head on over to nomoreshots.ca. There you can sign our petition and sign up so you never miss a report on this beat. That's nomoreshots.ca.